Articulators are tools used to create simulations of jaw movements. There is a long history of attempts to simulate the complex movements of the jaw joints. But even today's machineries achieve only partial success. It is of the utmost importance that the articulator is correctly programmed. You can see the various settings on the hinges. To obtain individualized patient values, one would have to analyze the patient's masticator organs through axiography. In this process, a computer records the various parameters of lower jaw movements. This data can then be used to program the articulator. Unfortunately, the axiography does not always generate values that can be reproduced. Multiple axiographies frequently lead to different values for the same patient. Furthermore, it is now recognized that the jaw joints are very susceptible to changes, and the traditional, strictly machine-oriented view of the jaw joints has increasingly been abandoned. In the past, patients were forced toward an ideal bite that was set by the articulator. This had the unfortunate result that many individuals developed facial pain. Nowadays, the treatment of jaw joints and the associated bite is much more restrained. Only pain is treated, not the discrepancy between the bite articulator function. In contemporary dentistry, there is a better understanding of the jaw joint. This has led to a revised view. The articulator is no longer considered the standard, but rather a resource or tool. You now see how the technician manufactures a total prosthesis with the assistance of the articulator. The teeth are positioned in wax for the so-called wax trial. The patient has to feel comfortable with his new denture. During the wax trial, the positioning of the teeth can be changed slightly. Only after a satisfactory patient trial can the teeth be permanently transferred into the synthetic material.